2:30 UAE time. So thank you for joining us today. And I guess I see already a number of people already in the room. So maybe if we can start the webinar right now. First of all, hello and welcome to Merck webinar titled Lean Six Sigma Implementation, a Case Study in Healthcare. The focus today will be about Lean Six Sigma implementation in the healthcare sector, an area that I'm very passionate about. My name is Fawzi Bawab. I'm one of the partners at Merck Training and Consulting, and I've been working with many companies and individuals as a consultant, as a trainer, as a coach, working on Lean Six Sigma implementation in the region and outside of the Middle East region. Over the next 30 minutes, I will go over a number of slides, after which I will open the floor for your questions. We will then take another 30 minutes or so to answer your questions. So at any time, feel free to type your questions into the chat window on your screen as I go along. We will capture your input, your questions, and try to answer all of them at the end. So if you allow me, just to get you a very quick brief about myself. As I mentioned, I'm one of the partners and senior consultant with Merck Training and Consulting. I've been with Merck since 2004. I hold a degree in civil engineering, bachelor's degree in civil engineering, a master's degree in industrial engineering, currently preparing my doctorate in Lean Six Sigma implementation at Heriot-Watt University. I've been involved with a number of companies before joining Merck. I've been working at KPMG Consulting in Ottawa, the Canadian capital, and also with BSI, British Standard Institution in Canada and in the Middle East region. Before that, I used to practice quality at IBM, GBM operations in the Gulf, and before that, I used to work with a regional consulting company by the name of Talal Abu Khazala. Over the last 25 years, I've created this passion of looking at quality, helping teams, working to develop and spread the voice of quality in different sectors. I've been very passionate about Six Sigma in particular, working and using the tools and techniques of Lean and Six Sigma in different sectors. Hence, I would like to share with you a case study in implementation of Lean Six Sigma in the healthcare sector in the UAE, United Arab Emirates. And I'd like to share with you the team findings, the team that I worked with to coach and develop the results. Great results, I have to say, but I'll take you through the methodology and the results as we go. I've worked with, I would say, over 250 projects in quality improvement and Lean Six Sigma over the years. I can tell you that we basically netted a savings of over $19 million. So, you know, quality pays, and organizations continue to benefit from implementing various quality programs and methodologies. So whether you're looking for a simple problem solving, a Kaizen event, Lean, or to develop your corrective and preventive action system, or to develop into an advanced methodology like Lean Six Sigma, so we can basically help through the coaching and the training programs that we offer at Merck. So let me get started. We're going to start with sort of a quick overview on description of Six Sigma. Again, you know, Six Sigma is a topic that I can spend days and weeks to explain. We will talk a little bit about the marriage of Lean and Six Sigma. There's been a marriage between Lean and Six Sigma, hence the name Lean Six Sigma. We will talk about the specific case study and the project charter and the problem statement that faced this hospital in the UAE. We will use the DMAIC methodology to address the project issue and how they handle that. And we will talk about the before and after results. And of course, I will share with you some of the take-home tips for people who plan to implement a Lean Six Sigma in any sector as well. So I want to, maybe before we get started here, just want to clarify a couple of things. again, because of the confidentiality requirement that we signed with this hospital as myself and Merck, I will refer to the hospital throughout the case study as Hospital X or X Hospital. This is part of the NDA agreement that we have signed with them. I'll be sharing some of the results as well as we go. Now, again, Six Sigma has many definitions, and I get this question all the time. What is Six Sigma? Can you please explain Six Sigma to me? Some people might refer to it as a methodology, but before we get into a little bit of Six Sigma definitions, let me get your own input, your own definition on Six Sigma. So if you allow me, I'm gonna run a simple poll question. So you have the chance to pick your own definition, and you can pick as many as you want. I'll give you a minute to basically put your answers, and then we'll share with you the voting results. So it should come right now. So pick your definition. You can pick more than a definition if you want. What do you consider it? Is it a metric? Is it a methodology? Is it a philosophy? Tools and techniques? Is it a complete system for improvement, process improvement? How do you consider, how do you look at Six Sigma itself? Okay, let's share the results with you. So we have some interesting remarks here. We have 46% that shows you that it's a process improvement, which is correct. You have 20% tools and techniques. We'll talk about that. Tools and techniques are the part of the methodology of Six Sigma. Metric for quality, what is Six Sigma? What does it mean to have a process sitting at 4.6 or 2.3 Sigma? So if we go back here, we'll see that Six Sigma can have different definitions. Some people might consider it as a metric. So if you can label a process by saying it is sitting at 2 Sigma, what does that mean? Well, it means that this process will create many defects, and we can look at what we call a defects per million opportunities. If you go to 4 Sigma, which is basically now you're telling me out of 1 million operations in the process, you will have around 6,200 plus defects. So that's a higher level of Sigma when you talk about defects. Of course, many people will think of Six Sigma as a methodology. They will think of the methodology that we call DMAIC, right? And they will talk about the steps they will use actually to achieve the improvement methodology. It's a philosophy because the philosophy will require your people, your staff, everyone to be on board, including your leadership. And indeed, you will use tools and techniques within the methodology itself to achieve success. So I can say many of the definitions for Six Sigma are correct. And it's sometimes even in the literature that you can look at, you'll find many definitions. So whether a metric or a methodology or a combination of tools and techniques used within or a philosophy for improvement, they tend to be correct. Now, I'll share with you a couple of my favorite definitions. Six Sigma is a structured approach focusing on improving processes, reliability in order to eliminate the defects in products and services. So this is what Motorola basically sort of named or defined, or it could be a comprehensive and flexible system for achieving and sustaining. You're maximizing your business results. It's uniquely driven by close understanding of the customer requirements or voice of the customer, and then looking at data and statistics to look at your process and to reveal and discover the root causes of the variations and the defects. So it's a complete methodology that will focus on collecting data, understanding your customer requirements, defining the process and understanding the bottlenecks or the issues, and then moving forward to achieve better business success and improvement. Of course, we'll talk about the financial impact. Every project in Six Sigma has to be measured in a financial impact, and it has to show results to the organization. So a good slide I will share with you to summarize everything that we said. Six Sigma is a methodology led by senior management, enabled by the quality team, driven by the customer needs. It uses a structured methodology called define, measure, analyze, improve, and control. It combines the use of tools, process mapping, histograms, Pareto, scatter diagrams, design of experiments, hypothesis testing. All these tools are basically taught to the Six Sigma professionals, whether at the green belt or the black levels, so they can actually use them throughout their projects. Also, if you look at Six Sigma as a principle, you're looking here at the spread and the distribution. So if you look at how we consider a process, this is the voice of the process, as you see here. And you can see here the voice of the customer coming in what we call the upper and lower specification limits. If you look at this, you can actually get an idea whether you have a process that is achieving the customer requirements and whether it is meeting the specification limits. Again, this process in front of you here can be for anything. This could be the cycle time for a check-in process at a hotel, or an admission for a hospital, or a cycle time for getting luggage to a belt and airport. It can be for a transaction, a service, a manufacturing. We become experts as Six Sigma professionals to transform any type of a problem into a statistical problem and then trying to understand the sources of variation in that process. We look here at Lean, which came in as a Toyota principle and helped Six Sigma to eliminate defects. So a quick definition here. Lean is a structured approach focusing on simplifying processes by looking at the non-value added and trying to remove them. The history started with Toyota, maybe Ford before that, but it was mastered as the TPS or Toyota Production System. And of course, as a Lean, your aim is to discover and identify and eliminate what we call the 7 or 8 types of waste that we discover in our operations. From motion to transportation to weighting, all these are examples of things that we study in our processes. And if someone is wondering what is the benefit of Six Sigma, why do we do it? Well, I can tell you that you can basically reduce the sort of waste. You can increase productivity, you can improve the efficiency. So instead of one employee handling 15 admissions in a day in a hospital, we can actually move that to 28 admissions a day, keeping the same resource. So that is productivity. We can talk about another example. A sales representative is focusing on 20% of his time on administration. So we can improve this to only yield or give you the same output within 10%. So you're basically freeing the 10% to actually focus on the actual core business of sales. In a simple definition, Six Sigma is about removing defects, identifying non-value activities, and reducing your operating costs. It's all about customer retention, customer satisfaction, and value-added activities. And here is the methodology. In a nutshell, practical problem being transformed into a statistical problem and then moving into the define, measure, analyze, improve, and control. As you notice, I'm trying to cover the slide so I can get to the case study, the actual work that we did with this hospital to actually achieve their customer or patient satisfaction. This is me. And again, I'm just highlighting here the fact that implementing Lean Six Sigma, you need to define the scope and you need to define the problem statement at the beginning and secure leadership support and staff buy-in. So I consider these are the critical success factors, if you may, to achieve a successful project in Lean Six Sigma: your leadership support, your staff buy-in, and the proper definition and scoping of the problem that you have in front of you. The hospital that we basically worked with, I worked with this team and coached them throughout the process or the project stages. Hospital X, this is a real hospital in the UAE. It's a 461 bed that basically focuses on the general, hospital services. It's managed by Johns Hopkins Medicine International and managed and supervised by Sihha, which is basically the corporation responsible for managing hospitals in the Abu Dhabi region. The hospital scope of services is basically ranges from different services. The waiting time was one of the strategic initiatives that the company wanted to deal with, and basically they wanted to enhance or reduce the waiting time. So the emergency department is one of the busiest in the region with an average of 6,000 visits per month. The complaints, the dissatisfaction was shown by patients on the long waiting time before being seen by a physician. So this was one of the initial challenges that helped scope the problem. Based on these findings, a Six Sigma project was initiated and a team was formulated to work and improve this in line with the strategic goals of Sihha and the hospital strategic goals. So if you look at the business case itself and the goals and the objective, the business case was to enhance the quality of care and to increase efficiency and to improve the effectiveness of its services. The specific objectives of this goal were to reduce the waiting time for triage category 3, 4, and 5 and improve the percentage of patients seen within the time frame recommended by Sihha by 25%. Another objective was to improve patient satisfaction and decrease leakage, and of course the revenue loss, which is now the financial impact. So this was the team case or the business case submitted to their management, which basically they gained approval and they started preparing what we call the project charter. So in terms of building the business case, the project, the description, the value proposition, the impact on the business and the financial impact, what were the savings, the projected savings, and what needs to be done in terms of the cultural change and the organizational change. This was discussed at the beginning of the project at what we refer to in a typical Six Sigma project at the defined stage. So this is where they defined the problem and they set their improvement targets, and they started defining who is the customer, and they looked at various tools to define the process. They use process mapping, as we will see. They defined the problem and they put some improvement goals. So if we look at the business case in more specific, here is a description. In alignment with the strategic objective of Sihha, Abu Dhabi Health Services Corporation and X Hospital, they basically focused on improving the patient experience in terms of reducing the waiting time, which is a key indicator in patient satisfaction in many or all hospitals. Emergency department waiting time is monitored utilizing the hospital information system report. So they have some monitors, they have some data to look at, and the key indicators requires them to achieve that 90% of triage category 3 patients must be seen by a physician within 30 minutes, and for category 4 and 5 within 45 minutes of registration. So they had issues with that, and they had a trend of low compliance, hence the problem statement here. And as you understand, having a patient to wait for too long, this is not something very helpful in terms of patient satisfaction for a hospital. The voice of the customer is telling them that there are complaints. 37% of the written complaints in 2013 were related to the waiting time, and 23% of the complaints were related to the waiting time itself. So basically what was happening here, out of the high number of patients, 1,068 in the sample, there was issues There were issues with what we call the long waiting time. So there was a confirmation from the voice of the customer, the complaints, that we have an issue. The voice of the business is coming from SIHA, it's coming from the regulators in terms of telling them that they have a certain sort of deadlines and specification limits they have to meet. So they also confirm through the voice of the business that they were losing money and they had issues as well there. The baseline summary, very simple: 3,832 adults attending in the emergency department January were analyzed, the data was analyzed, and the number of visits were looked at using different tools, the Pareto and others, and the correlation between the number of visits and the waiting time was very low. The regression coefficient R was 0.08, meaning that the volume of patients visiting the emergency department for less, it accounts for less than 10%. So you cannot really link the number with the waiting time. There must be something else, and that was the scope of the project they wanted to look at. They looked at the process stability was unstable, and we will see now the tools they used to reveal that. The first step in analyzing any process, I tell my students and participants, is to create a clear idea of the process. And one of the well-known tools that we look at and we teach is the typical process map. So what we did here, we created the as-is process map for the emergency room process, the emergency department, and this is how it operates in the current status at that time. And that process revealed immediately for the team some issues with what we call waiting or redundant. We also did a Cyclope, which is one of the tools that Six Sigma practitioners will use, stands for supplier input, process steps, output, and customers analysis. You can see here an analysis of this process. And this is very useful for us to understand who are the stakeholders. So there was a stakeholder analysis done to reveal the aims and what do they need from us. That was very useful at the beginning of the stage. A project charter was formed showing all the details and the time frame and what needs to be done. And that took us basically to the page or the next stage of measuring. Now, the measuring stage is a very important step in Six Sigma, where the team will be tasked with getting what we call information about the X's that will affect the Y. The Y in this case is basically the waiting time, the long waiting time. So the team started to develop what we refer to as a measurement plan or a measurement matrix, which we use to identify what are the areas that we need to measure. What is the operational definition for the data? What is the data source? The sample size? Who will collect the data? When will we collect the data? The data collection method and other data that we need to collect. The whole idea here is basically to use the data to help us reveal the root cause for the problem. So as you see, this is a critical part of the analysis in the project of Six Sigma. This is usually time consuming, especially if you don't have the data that you have decided to measure in this project. As we went into data analysis, we started using some graphs. Yeah, I have here the graph. So we started to reveal some issues about the patient's arrival patterns, relationship between certain X's and Y's, distribution of data. So as you see here, we started using or transforming the data into histograms, into box plots to reveal whether, for example, we have zones of patients or waiting time affected by a certain time or a certain category. Again, you can see here how the categories 3 and 4 being split, and you can see the descriptive statistics of waiting time for activity category 3 and 4, and you can see the box plot trying to reveal whether there are any patterns or trends. Again, Six Sigma practitioner, this is what they learn. This becomes their bread and butter in terms of identifying where should we focus our efforts, what is causing the variation. So this is a very critical area that we basically use in graphing. Of course, the softwares are available such as Minitab or SPSS or other softwares. In average, patients waited 12 minutes more than Sihha targets, and the variation was extremely high. The standard deviation of the data presented was around 52 minutes with a very large number of extremes. So this is a very important information to show you that there is indeed a problem that we have in front of us. We use a tool called Minitab for analysis of data. This is called the six-pack chart, and you can see here we've got issues with stability of the process. We have out of control. We can look here and we can see that the data is not normal. We can see here from the histogram that we have issues with the process capability. So this is the as is, and we can look at this as a baseline later on to compare before and after. So again, process capability is an indicator that we try to transform into, of course, a sigma metric. And based on all of this graphing analysis, summary of the measure stage. So the data, 3,832 adults attending in January 2014 was analyzed, and the results were shown here that between certain times, 8 and 12 noon, there were some increases. Correlation between number of visits is very low, frequency distribution, and process capability is very low, producing 44.8% defects, i.e., people are waiting more than the allowed time by Sihha, which is the target. So we have a problem here that we need to address. So what happens next? Methodology tells us we need to go to the analyze. So the analyze is basically to look at the root causes, look at the causes of waste, and discuss what is the potential root causes and verify the assumptions so we can work with that. So the team used something called the fishbone analysis, known sometimes as Ishikawa, or known again as the cause and effect diagram. And this was the team discussion to try to discover where are the areas that could cause the waiting time at the emergency room. This graph, again, root cause analysis, a very well-known tool called the Pareto, and the Pareto immediately start to reveal here that we have certain areas that we have to do, we have to address. Shortage of physicians came as number 1 here, shortage of nursing staff came at number 2. So you have here some analysis done by the numbers to try to reveal what is the root cause. Summary of the analyze, the patient tracers and value stream mapping help to understand the patient journey. The 8 forms of waste that we basically borrowed from Lean were analyzed, and we looked at some of the quick wins that we can discuss. The team was able to identify 66 underlying causes and sub-causes causing the lead time to exceed the time mandated by Sihha. Improve was the stage where you develop solutions to address the root cause. So what is the best solution? How can you compare between solutions? How can you deploy the solutions? This is part of what we want to look at in terms of the improvement stage. So as we go to the improve stage, based on the cause and effect diagram, an action plan was put together with the main stakeholders to look at what the team can do. 4 brainstorming sessions were conducted from cross-functional teams, and the actions suggested were categorized under the 6 identified areas of concern: patient, manpower, management, materials, environment, and methods and communication. And for each of these causes, a corrective action was proposed, and here is what is happening at the improved stage, and a table was put together as an action plan to define what needs to be done by whom as well. The team also decided to put together what we call the selection of the actions based on impact and easiness. So you can basically pick the best action that will have the highest impact and the easiest to implement. So they use this technique to assess and evaluate and select the best action based on impact and easiness or implementation in terms of the corrective action. They run a pilot run where they did a quick win solution to evaluate the benefit, and 2 physicians were assigned to the triage area to assess patients. So they started putting some plans in place. Waiting time retrieved from their system immediately showed significant improvement in all categories. Right, so now they went to 94% and 100% were seen within 45%. This is a substantial improvement in terms of the waiting time that they had issue with. So the final stage usually is the control, where we monitor, we sustain the gains, and we make sure that all the gains that we basically realize that they improve will stay in place. So the team decided to put in some plans, monitors, corrective actions. They added control charts to look at how they can improve. So they had here a process on how they can control, so to finally close the project. As you see here, okay, this is sort of a comparison of the control chart, one of the very good tools that we use to compare before and after. You can see here, although not very clear in this chart, you can see there's a drop, and it was here, this was the upper. You can see there's a drop in the average. You can see the variation has dropped as well. This has been confirmed, of course, by a box plot and by, of course, the histogram and the process capability study. Taking this into numbers, the Z bench or the sigma level increased from 0.13 to 0.97. Of course, there is more room for improvement in this case, but there's a 63% improvement in the waiting time just to get started with this project. Again, the results here, the voice of the customer was remeasured to ensure that we have reduced the complaints, and it revealed a reduction of the written emergency department patients complaint from 37% to 23%, and there was another measure or another initiative also that confirmed that there was improvement before and after. In Six Sigma, it is critical that we do what? We do the before and after, just like any good physician will do. We need to look at the before and after results and confirm that the results were in place. Here's the control measures to ensure that we sustain and we continue with the improvement project. Here's a description of the tools used throughout the project, the case study, stakeholder analysis, graphical analysis using histogram, control charts, cause and effect, box plot, just to give you a flavor of the tools that we use in a project of Six Sigma. So you can see many of these tools were used at different stages, and the conclusion here shows you that the goal of 25% reduction was accomplished and decreased by 63%. The DPMO, defects per million opportunities, was decreased by 63% in June. Short-term sigma increased from 0.13 to 0.97. Estimated savings done by the team to look at the loss of revenue because of the waiting time was in the around 11 million dirhams per year. So that is a substantial amount of money that the hospital used to lose because of the waiting time. And this was, something they started in 2013 and 14, and it was concluded through the end of 2014. So what are the takeaways if you want to discuss how would you proceed with a Six Sigma project and ensure its success? The engagement of the stakeholders, whether staff, the support of the senior management is critical. The team collaboration, this is a team effort, and teams should be on board in terms of the buy-in, the objectives, the shared vision, commitment and clear rules of engagement throughout the project, utilization of the rules and the tools and the approach in Six Sigma, and the continuous and close follow-up throughout the project. I would call these are the success factors that we could use to ensure in our future projects. Again, I tried to give you a summary of a project that basically lasted for 8 months of work by this team. The team did a great job in achieving a success in this healthcare organization, a hospital. And it's a privilege to have worked with them and to have coached them through the training and of course, the project itself. So I'd like to stop and, of course, allow you to throw in your questions, and I'll be glad to answer your questions. So you can write your questions, you can write your objections. So anyone here from the healthcare industry, anyone who been working on Six Sigma projects, any obstacles, thank you, Muhammad. Yes, the 820, Muhammad, which is known as the rule of Pareto, correct? Absolutely. Pareto, which is known as 820 rule, was originally developed by an Italian scientist by the name of Ferdo Pareto, hence the name the Pareto chart. The Pareto chart or the Pareto tool is widely used in any project in quality, including Six Sigma and Lean. It is basically a tool to help us prioritize and understand where should we focus our efforts when we start any initiative for a project. For example, let's assume you're a company and you're receiving a number of complaints and you're basically capturing them by categories, by service, by design, by packaging, warehouses, and you would like to get an idea where would you focus your efforts. So you will build a Pareto diagram, which basically will put the highest number or frequency of occurrence on the left side, and then you will start building what we call the cumulative percentage. The percentage will be calculated, so the first bar will be calculated as a number, and then you divide that on the total and you get the percentage, the second one. So then you will come and say 80% of the complaints that we receive in my organization are under the service and under the design areas. So basically that gives you a flavor that you need to focus your efforts under the design and the service area. Of course, Paretos can be expanded to come into a Pareto with a Pareto. So that's usually a very, very useful tool that we use in many stages. Hence, we tell people 80-20. I mean, I can give you a very nice example that people sometimes agree with, and they say 80% of work done in organization is done by 20% of the staff. Not a very good organization, is it, right? I mean, everyone should be sharing the same load, but you can look at an organization and say, yeah, that to some extent makes sense. I hope that was useful. Usually we would put drawings and numbers as well. All right, another question. Joe, so can these same steps be implemented in a pharmaceutical company? Absolutely. Six Sigma, Lean Six Sigma can be implemented in any sector, manufacturing, healthcare. Actually, you can implement it in any process once you have the scoping and the right problem statement for that. So in pharmaceutical, whether you want to tackle pharmaceutical processes, production, or you want to go to the customer service, you want to go to the supply chain. Actually, I did have a number of projects with one of the largest pharmaceutical companies in the world. About the projects were about supply chain, and we had a number of projects handling the procurement time, the tendering process. So you can actually look at multiple processes within a pharmaceutical industry. All right, so another question. Okay, Rajiv, so does Six Sigma process reviews on risk basis as usually done internal controls processes? So I'm trying to understand your question. Risk reviews on risk basis. What we do, the selection of the project itself, we might actually do a risk assessment in the beginning to try to identify the processes that may have the highest risk in our organization. You might use a tool called FEMA, Failure Modes and Effect Analysis, to identify which areas, which processes that you might look at. And you use that at the end as well at the control, so I can actually have better internal controls for any areas that might appear as risky areas. So you can actually blend or bring risk into the Six Sigma deployment by having it at the beginning, the project charter selection, the project problem statement, and later on at the control stage. I hope I got your question right. So, questions? Thank you, Rajiv. Thank you. So Pareto, yes. Pharmaceutical, yes. Risk. Great tool, powerful tool. People attending my sessions in the green belt, black belt, they learn a very powerful tool. They leave the room, they leave the session, and they're very eager to go back to their organization and try to implement it. The thing is, you need to have the right structure, the right environment to implement Lean Six Sigma in your organization. I see another question from Joe. How can Lean Six Sigma be effective in the production area, or is it only effective in the supply chain unit? Absolutely. Again, in production, I've worked with a number of production units in the manufacturing areas. If you have a production area and you ask your production people about defects, about scrap, about rework, about areas where they basically have to spend too much time dealing with an error or a defect. So if you start that discussion with your production people, they will start talking about maybe their corrective action requests, maybe their incidents, maybe talking about wasted time in some of their operations. So Lean Six Sigma can be about the improvement and in raising the efficiency and productivity in production area. We might do a process map sometimes, or we might come back to the voice of the customer and reveal that complaints are about a certain defect that production area is responsible for. So again, Lean Six Sigma can be implemented at the customer service area, at the production, manufacturing, at warehouses, at hotels. I've done it with hotels. I've done it with airports, I've done it with airlines, I've done it with pharmaceutical companies. IT can do it a lot in their processes. So what I'm saying, any process, even a restaurant process, a hotel process can actually benefit from Lean Six Sigma as long as you do the right scoping and the problem statement formulation. Oh, I see Amber as well. Okay, another question. Yes, Muhammad. Kemal, the critical step is collecting data. How can you guarantee the data reliable and not biased? Okay, very good question. We do discuss, and as I mentioned, measuring stage is one of the critical steps in this methodology. No data, no project. If you don't have the right data, of course, you will have garbage out. So one of the things that we discuss at the measuring stage, something called measurement system analysis, or MSA. We discuss about the bias. We discuss about how do you ensure when you collect the data, you collect the data that have a relation to your project. That is the first thing that you want to do. And the second thing, how do you ensure that the data collection and the sampling is done right? So in the training, we discuss how do you do proper sampling, what is the type of sampling, would you use random sampling, systematic, all these types of different samples. What is the sample size? You're using it on history. Are you doing forward data collection? Of course, the science of data collection, data analysis is vast, and we can discuss on how sometimes even you might collect the data, but the analysis itself might get you into a bias or reactance of the people who are measuring this. So when you develop the measurement plan, which we discuss at the measuring stage, we usually discuss on how you can put the right operational definition for the data, how can you train your people to collect the right data, how you can sometimes conduct what we call the measurement system analysis, especially if you have people measuring. And this is where you get into the science of something called the gauge R&R, which we train people on how to do. Usually it's done in manufacturing or wherever you have any type of a measuring exercise to ensure that the data can be trusted and you can rely on the data. So this is a very critical one. Finding the data to collect, how to collect the data, and how to ensure the data is reliable and you can basically use it for your analysis. Oh, great. I hope I've answered Muhammad. Joe, we have some engineers who are working on Six Sigma. They check the variations as per specific. There's some research on Six Sigma and I found that it's a major task to reduce the variation to 3.4. All right, so you're saying here, reducing the variation to 3.4 million, that is what we refer to as the Six Sigma level. Now, Six Sigma level is something that, we aim to reach, but depending on the business, depending on the customer needs, we don't have to reach that level in each project. Sometimes we do projects, the process is sitting at maybe 1.9 Sigma, which is not very good in terms of quality, and we're able to raise it maybe to, 3.5 or 4.2. Maybe that's enough. Maybe that's enough defect level for the customer, and you want to do it gradually. Sometimes it's very hard to jump from 1.9 to a Sigma level, to Six Sigma level. That sometimes require a huge investment, changing, revamping, re-engineering your operations. So the question is, can we achieve it in production? Yes, but the question is, do you need to achieve a Six Sigma from your first try or first project? Because that could be basically a total revamp and re-engineer of your operations. Many companies will start with what we call the Kaizen, the improvement, and then they will start to ask the question, do we really need to get there? And the best person to ask that is your customer. Sometimes a customer can live with maybe 6,000 defects per million. Out of a million time you deliver a product, you're accepting the 6,000. So, you don't want to get to that level where the benefit cost analysis doesn't make sense. I hope I answered your question, Joe. So I think there's any one last question we can take. And again, feel free to email me, drop me a line. The presentation will be available for you. I'm ready to answer any of your questions or emails in the future, and hope to meet you in the near future.
Merck.com